Welcome back to the School of Balance. This month's interview is part of an ongoing special on how people cope when they're ill or injured, and that starts to impact their goals and passions. If you pop along to the website, there's some more interviews already on there, and today we've got Rachel Stanley, who's an osteopath here in London. Hi Rachel, how are you?
Hi, I'm good, thanks. How are you?
Thank you so much for agreeing to do this.
My pleasure.
It's lovely to chat to you, and I just thought, first up, it would be really good to understand a bit about who you are and what you do. So would you be able to just let us know, please?
Okay, so I'm actually studying at the moment in my final year at the British School of Osteopathy, which is located sort of near London Bridge. I am now practicing in the clinic that's attached to the uni. I do that 3 half-days a week. So you get quite a varied lot of people through the clinic, and it offers discounted treatments to people and various sort of clinics and things that they offer.
Oh, wonderful! That sounds really good. And what got you into osteopathy in the first place, then?
Well, I come from a slightly medical background. Both my parents are GPs, but initially I sort of started off with a different route. I was doing English literature at university first, but had a kind of quarter-life crisis and decided what I really wanted to do was work with people and sort of really help.
Oh, brilliant. And what do you find most rewarding then? Is it the working with people?
I think it's just a really interesting career to take, and every day could be different. It's very varied, and you're always sort of thinking, you're always sort of testing what you know.
Yeah, I guess it's a lifelong learning, isn't it?
Yeah, definitely.
Wonderful. Now, I know this might sound like a bit of a funny question, but would you be able to sort of explain a little bit about what osteopathy actually is? I have a vague understanding, but I think it would be good to hear from yourself what it is.
Absolutely. So it's classed as a alternative therapy at the moment, so it's not available directly on the NHS like something that's also a manual therapy like physiotherapy, for example. It's kind of a combination, I guess, of physiotherapy and something like chiropractic. So we do a massage, articulations, help with rehabilitation programs, and offer exercises and advice, and also HVTs or HVLA, which is high velocity, low amplitude movement, putting sort of a bit of movement through a joint, which some people might know about, like a little click sort of thing. So they're the kind of treatments that we offer, and it sort of varies between practitioner what they choose to sort of make their inform most of their treatment. And as an alternative therapy, it has, like, osteopathy has its own philosophy. Started off in America by I'm now forgetting his name, but a very important guy. And really, it's like the philosophy is about looking at the body as a whole, thinking about the person and how sort of the problem fits into them as a person, and how it might be affecting their sort of mindset and things like that, I guess, as well, is quite an important part. And quite often, because osteopathy isn't available on the NHS and is private, it allows practitioners that bit more time to get to know a person, build rapport, kind of get to the root of a problem, which sometimes I feel is lacking, and not to anyone's fault in other sort of manual therapies available through the NHS.
Yeah, no, I can understand that. And I guess from the holistic point of view, the whole body is connected, physically, but I guess also from a biochemical point of view as well. So I assume if you've hurt one area of your body, it could have a big impact on another area. The story I always remember is new mums that are holding their babies on their hips constantly often end up with, say, knee problems because everything's out of alignment. Do you see a lot of that kind of thing?
Yeah, no, exactly. Like, so there's something like that. It's kind of like a mechanical connection, and that can happen a lot. So one thing that some osteopaths might do is like the classical osteopathy, which to my knowledge is very much sort of you treat the whole body, kind of treating as you find, and there are connections sort of particularly through like gait, so like walking, things like that then can impact further up sort of the chain, further up the body. And then there's also things like stress, how that can affect sort of the more physiology and like biochemistry of the body, and like hormones, things like cortisol, stuff like that being produced, and how that affects healing. And there can be those connections as well as sort of the mechanical ones.
Oh, that's really interesting. So when you're in the clinic, what are some of the main examples you see then? You know, is it mainly injuries or what sorts of things come up?
Well, I think possibly like the clinic where I work, it slightly differs to private practice. You know, people when they've qualified, who might see a lot more acute patients. So someone's just sprained their ankle, or you know, just sort of done their slipped a disc or something that someone might say, and they can be acute. We see quite a lot of chronic patients, so people that have had their problem for a long time. So in that sense, it's slightly different. So I can't remember what the question was.
No, that's good. It was just the examples of what you might see.
Yeah, so something like that. There might be someone who's suffered from sort of back pain for 10 years. Maybe they haven't sought help until now, like it's just got to a point, or it's one of those things that we offer sort of maintenance treatment every month or something, just to keep them sort of able and working and sort of within the realms of what they can cope with.
Yeah, I can understand that. So I guess a lot of that must be about the advice of what they should and shouldn't do and how they can go about their day-to-day life. If you found that somebody, say it was somebody who was quite active, liked working out a lot and did a lot of exercise, and all of a sudden, you know, maybe their back pain had got so bad, or they'd injured their legs or, you know, ankle or whatever, what sort of advice do you give? Is it sort of back to basics? Is it doing something different to they used to? Maybe something less low impact? I don't know.
Well, it was always quite hard because everyone that comes in is sort of, there's an individual approach and like things that they want to be able to do. So we call it agency. So what you want to be able to achieve in your life, whether that's, you know, you're an 80-year-old and you want to be able to walk to the shops, or you're, I mean, I don't see any, but you know, an athlete, the kind of what you're hoping to achieve is very different. Still is like what's important to you, so how to make that happen. And you talked about someone who's very active and maybe injured themselves, and then what we'd do for them. Again, it helps if someone's really sort of enthusiastic and keen to sort of get back to health, but equally sort of within that issue, you want to make sure they don't overdo it. They know the importance of sort of listening to their body, and whilst like rehabbing and something, that they also rest. But then you'll get other people who would sort of have this like fear avoidance of not wanting, maybe someone's told them, oh, you should go lie down if you're injured, and then they don't want to, they sort of have movement avoidance and fear avoidance of doing certain activities because they feel it will make them worse. So it's kind of between those things, or those types of people, you'll find out what sort of works for them and what you feel like might be bad for them and stuff. I mean, something like swimming, it's always quite like good for injury as long as they enjoy it. For being like off weight bearing, but so
yeah, of course.
Obviously it won't help. So it does depend on the person and on the injury. Really.
Yeah, I think I'd probably fall into the former category. I don't think I'd be a very good patient. I have a tendency to want to do more than I can. So I definitely...
Like, enthusiasm is good. It's just sort of, then your advice is obviously just different. You're not sort of encouraging so much. You're just like reining people in a bit.
Yeah, of course.
And like so, like we always like there's a lot of talk about building like core strength and things. If someone's hurt their back, and then people automatically will launch into doing like sit-ups, which if you've hurt your back, it's quite hard to control sort of where the control's coming from. So like you not being able to use your back, and then people, it hurts people. So
yeah.
I'm like starting small and building up.
Yeah, no, I can understand that. Baby steps. You mentioned a little bit earlier about the fact that you also have to take into account people's mindset. Do you find that you get people coming to you that perhaps they're frustrated because they can't do things they used to do, and do you almost end up not being a counsellor, but ending up giving them some kind of support in that arena as well?
Yeah, definitely. I mean, I think there is sort of a fine line between sort of not wanting to counsel someone, but most of the time what people are going through, it's not sort of psychological issues, it's just how they feel about something.
Yeah, it's frustration.
Yeah, frustration. And if we're able to like recognise that and build that into our treatment approach and management, then that's really helpful, because that really sort of informs how people are going to respond to your treatment and how they're going to improve. Mm-hmm. So, yeah, no, I definitely think it's important, that side of things, to people's frustration and what really sort of you have to listen to what they're wanting. Like I was talking before about agency, what they're hoping to achieve, and whether you can help them do that, or if it's something really unachievable, kind of put them, not put them down, make them put it down gently, but think of if there's a different way to approach it. Say if someone's always wanted to run a marathon or something, and their goal, and they've got arthritic knees or something, and if they really wanted to do it, you encourage them and you find a way around it. But then equally, if you can sort of find another approach that wouldn't be so damaging to their body, then you can do that.
Yeah, so explain the risks and let them make their decision, I guess.
Make sure that people are informed and then can still make their own decisions. So it shouldn't be us telling anyone what to do. It's just giving that information and advice, and then allowing people to sort of make that decision for themselves.
Yeah, no, I understand completely. Given you must spend quite a lot of time talking to people, do you find that they teach you things as well? Is there anything you've sort of picked up that is great from a mindset point of view if someone's really frustrated, and anyone that's got any tricks or tips that you've picked up from your clients?
I can't think of any real tricks or tips. I mean, I think it always, when you've sort of had an injury yourself, I think that's kind of where it helps with like the clarity almost of when you see patients. Say if you've been like frustrated with them, they're not following sort of your management approach, but then you do something and you forget to do all the sort of the things that you know you should do, like your own worst enemy when you're a patient yourself, and you forget to ice and you don't do anything like that. So I think that sort of helps, like the understanding not to become frustrated with people. No, I can't think of any tips right now, I'm afraid.
No, I can completely understand that though, because I know myself that you might know what's the right thing to do, but sometimes it can be really hard to turn that into a habit. It's the best thing to do, but you just can't quite be bothered to go and get the ice out if you needed to ice, or do those little exercises or whatever. So I can see how that can be frustrating for people, but equally frustrating for you if they're not following it.
Exactly. I think it's sort of making something into a habit or into like their lifestyle that isn't just those osteopathy exercises, whatever. Whether it's when you're cleaning or walking the dog or whatever you actually already do, and then trying to put those exercises into something that's already part of your life makes it a lot easier, I think.
Yeah, that's a really good idea, actually. I know it sounds silly, I hadn't thought of it like that, but if you can incorporate it in your day-to-day life, then it's not another thing to do, is it?
Yeah. I mean, people are busy, so...
Yeah, exactly.
If it's a thing, then sometimes it just gets put by the wayside, so...
Oh, brilliant. You spoke earlier about the clinic you work in. If people wanted to, find out more about the clinic or maybe even come along, how would they do that? Is there a website or something I can direct people to?
Definitely. I mean, I don't have the website to hand, but if people put it in Google, it's the BSO Clinic, and it's on Southwark Bridge Road.
Brilliant.
I don't have the number to hand. We have sort of a general clinic, and then also mother and baby clinic, an expectant mother's clinic, and sports clinic as part of it, and a number of other ones as well. So the sort of specialist clinics within it, but offers sort of discounted treatments. Like if you're a student, I think it's free. So it's worth having a look if it's something you're interested in. And you get seen by student osteopaths, but we are supervised by qualified osteopaths.
Mm-hmm.
So you'll get a good treatment. There's lots of knowledge in there.
Oh, that's brilliant. I'll include the details on the website, so if anyone wants to pick up the website there, they can find it at the School of Balance. I guess just before we move on to the quick fire round, is there anything else that maybe I haven't covered that you sort of would like to point out to people, or should we just get going?
Nothing I can think of right now.
Brilliant. Well, each time I do one of these interviews, I just try and finish off with a little quick fire round, just so people can get to know a bit more about you as a person, rather than just somebody that's being interviewed on a topic. So first up, what's your favourite vegetable?
Asparagus.
Oh, I love asparagus, especially when it's in season. What was the last book you read?
Well, the one I'm reading now, I can't say the author's name. It's by the guy that wrote the Kite Runner. It's called And the Mountain Recade.
Ah, yes, I know. I've read the Kite Runner. I've not read his new one.
Yeah.
Brilliant. I'll pop it on the blog as well. Wonderful. What's your favourite relaxing activity?
I don't know. I do quite like going for a run. It's a very slow run on my part, though.
Well, it's the doing it that counts, isn't it? If it makes you relax.
A definite walk and jog.
Yeah, perfect. Well, it's being outside as well, I guess.
Yeah.
And finally, what's your favourite treat, food or drink?
The first thing that popped into my head was chocolate, but I like treats, so I'd be quite happy.
Anything will do, but chocolate preferably.
As well, put fruit and chocolate together. The winner.
Perfect. Sounds good. Well, thank you so much for joining us today. It's been wonderful to chat to you. And as I said earlier, I'll pop all the details of the clinic on the website, so if anybody wants to find out a bit more, they can do.
All right. Thank you. Nice to speak to you.
Thank you. Speak to you soon. Bye-bye.